Hello and good morning. My name is Joshua Nancy, and welcome to my discussion on evidence-based care and remote collaboration. I'll be reviewing the following clinical scenario and then outline an evidence-based plan to improve the patient outcomes and safety. Today's discussion will go into the situation in depth, as well as evidence-based models that help create plans and strategies for encouraging remote multidisciplinary cooperation. My summary of the health scenario. The patient referenced in today's clinical scenario is a 35-year-old female who has been recently diagnosed with anxiety and does not have reliable access to specialized mental health care team due to her living in a rural area. The patient exhibits symptoms of restlessness, excessive worrying, and difficulty concentrating. Due to the patient's living situation of being physically located in a rural area, the nurse in this case study arranged for a remote interdisciplinary meeting between a therapist, a psychiatrist, and social worker to provide the patient with evidence-based care for her anxiety diagnosis. The psychiatrist carefully reviewed her medical record, and the psychiatric evaluation results confirmed the patient's diagnosis of anxiety. As a result, she was prescribed selective serotonin reuptake inhibitors, or SSRIs, and benzodiazepines. Beginning medication therapy would help ease her symptoms and enhance her quality of life. The therapist could provide remote cognitive behavioral therapy, or CBT, to assist with this patient and effectively manage her anxiety symptoms. These remote sessions would involve techniques such as exposure therapy, relaxation exercises, and cognitive restructuring. The patient's progress in managing anxiety and developing effective coping mechanisms have improved since beginning therapy. In addition to discussing stress management strategies, the social worker gave the patient, her, and her family access to local resources that would teach them about stress management and self-care. The multidisciplinary team decided to do frequent virtual check-ins to assess her development and offered her continued assistance. The established care plan. So, based on the information gathered from my case study, the multidisciplinary team worked together to develop an individualized treatment strategy for the patient with the goal of reducing her symptoms and improve overall quality of life. They employed pharmaceutical therapy, conducted teletherapy sessions, offered community support services, and taught her anxiety management techniques. Medications for depression are among the several treatments that are being advocated for the treatment of anxiety. Several psychotherapy approaches, including various types of cognitive behavioral therapies, or again CBTs, have received evidence-based support. There has also been some progress in the assessment of non-cognitive behavior models as potential treatments. People who suffer from anxiety often engage in emotional avoidance and hold negative views about themselves. These therapies include a range of tactics to help patients overcome these issues. This is from iAlert 2021. Some of the various types of anxiety disorders can include generalized anxiety disorder, which is defined as a persistent anxiety and tension combined with excessive fear or worry about routine activities and occurrences. Pain disorder is characterized as recurring panic episodes that are unexpected and not limited to a single scenario, with physical and mental symptoms including palpitations, nausea, and overall fear of losing control. Feelings of self-doubt and crushing fear of talking to strangers are a common symptom of social anxiety disorder. Physical symptoms include fast heart rate, shaking, excessive sweating, and reporting periods of brain fog. This is from NOAC in 2023. For the proposed care plan and utilization of research-based models, the following plan of care I would propose for this patient would include starting on a titrating dose of a medication in the selective serotonin reuptake inhibitor class with interdisciplinary guidance. For this example, I chose Prozac. This should be paired with subtle lifestyle changes such as the incorporation of scheduled physical activity and exercise, frequent care team follow-up appointments, seeking personal counseling, for further cognitive behavioral therapy sessions, or even reading self-help literature. The primary care provider and patient should work together to create a unique treatment plan that all parties can agree on with the patient's preferences in mind. One medication that is commonly prescribed as the initial pharmaceutical treatment for anxiety is Prozac. Um, Prozac, or fluoxetine, is classified as a selective serotonin reuptake inhibitor, or I'm just going to say SSRI. Antidepressants, including fluoxetine, are frequently prescribed to patients with severe depressive tendencies to alleviate anxiety and depression. Nevertheless, the psychological well-being and overall quality of life of patients are significantly improved by a well-balanced combination of medical interventions. It functions by enhancing the concentration of serotonin, a naturally occurring substance in the brain that contributes to the preservation of mental equilibrium. This is from Na Sun in 2024. Please refrain from discontinuing fluoxetine after 1 to 2 weeks due to no change in improving symptoms. The medicine does need at least 6 to 8 weeks to start feeling any sort of therapeutic effect. Providers normally start adult patients out on a low dose and then increase dosages after 1 month if tolerating the medication on an incremental basis with low dose benzodiazepines in the short term to bridge the symptoms until therapeutic dose is achieved with the SSRI. It is recommended to continue taking fluoxetine even if the patient is starting to feel well, as the doctor should be the one to gradually decrease the dosage safely. Nausea, migraines, irritability, diarrhea, insomnia, fatigue, and difficulty falling asleep are among the most prevalent adverse effects. There are certain herbal products or over-the-counter medications that could also interact with Prozac. Consequently, it's advisable to maintain a comprehensive record of all medications that a patient is currently consuming to avoid an adverse drug reaction. The Johns Hopkins nursing model was chosen for the development of my evidence-based plan and as the basis for evidence-based practice nursing models. The model's objective is to guarantee that the most recent research findings and best practices are implemented in the routine care of the patients. The model comprises of three stages. Step 1 entails establishing questions. Step 2 involves the gathering of evidence to substantiate the answer to the question. And step 3 involves the development of a strategy based on the research. This is coming from Dang 2022. The identified issue was the absence of physical activity. Fatigue, irritability, and mood swings may result from anxiety. Some of those symptoms can be alleviated by increasing physical activity as well as incorporating the other non-pharmacological interventions mentioned earlier. Numerous studies have demonstrated that anxiety symptoms are diminished when individuals engage in regular physical activity and reduce non-essential screen time. This is coming from Alves at 2021. Communication changes and collaboration related to telehealth. To treat this patient's anxiety diagnosis, the multidisciplinary team members are all working remotely with her due to her rural location. As a result, the time and date of the following meeting should be decided upon before the previous one ends. As a result, the team's communication will improve since everyone can plan and be prepared for the next one. In places where access to healthcare is scarce, telehealth can be beneficial. When test results are available, having the team meet or communicate via secure channels to discuss adjustments to the treatment plan might facilitate the expansion of telehealth through improved communication. In between consultations, telehealth enables patients to communicate with numerous healthcare providers about issues that might be promptly resolved or addressed during follow-up visits. Without telehealth, the patient in this scenario would not have had access to a psychiatrist, a therapist, a social worker, or any other applicable healthcare worker since there is no specialized mental health care near her location. In conclusion, having a multidisciplinary team that uses telemedicine is crucial for patients' medical concerns when they live in remote locations. There are several approaches to treating anxiety, but the best way to decide on a course of therapy is to work with the patient and include them in the plan as well. As part of my suggested treatment strategy, I would start the patient on a low-dose SSRI medication and include more exercise and other lifestyle changes into her everyday routine in addition to a low-dose benzodiazepine in the short term to help with the symptoms. I hope that you gained some new knowledge about the subject and enjoyed my presentation. Thank you for your time.